This is exercise that helps reinforce bending from the hips rather than bending in the lumbar spine. But it's also really good for facet mobilization and flexion of the lower lumbar spine. And it's nice to take a hand towel and fold it a couple of times for padding and just put it on the back of the pelvis. And so the client will stand with feet as wide as the shoulders, and heels are 4 to 6 inches forward. And one shouldn't overthink this exercise. If you do it as described, it's done correctly. And you touch the wall with your shoulder blades, and then you bend forward, nose goes in front of toes. Touch the wall, nose in front of toes. And 30 is the number that I recommend, and it's a great one to do every day. Okay? The next exercise that I think is a very good one for low back pain prevention is, because we all get a twist in our pelvis from driving cars and functioning in a right-handed world, we get a little twist in our pelvis, which some people call a right anterior ilium. And to counter that, we hug the knee and bring the knee very gently outside the right shoulder, and do that for 2 minutes. The other exercise is to gain hip rotation. We tend to lose internal rotation of the hip, and that also comes as a result of using foot on the brake and on the gas pedal. And so you take your towel roll and roll it up very firmly, about 2 inches diameter. You can put rubber bands or you can tape it. And what you do is you place it under the outside of the front pocket. And the seam of the pocket is right at the level of the trochanter. You can put your hand there and bounce your foot in and out, and you'll feel this bump, and that's the trochanter. And you put the middle of the towel roll under the trochanter. And this is a great one to do once a week for 5 minutes. We also tend, from driving cars, to lose hip extension. And so I like to do a psoas stretch, sitting on the side of the bed, but taking that same towel roll and placing it under the proximal thigh. And we hold the knee in straight. Okay, it tends to fall out, but bring that in and slowly lay on your back, hug the right knee, and you let that right bent knee just hang off the edge of the bed. And this is a good one to do for 5 minutes once a week. That twisting pattern in the pelvis, which I call an anterior ilium, if you bend your knee, your right knee, and twist your pelvis to the left, you'll tend to replicate that pattern. A very nice stretch for treating the left side of that pelvis, taking it out of that pattern, involves sitting on the side of your bed. Bring the feet up, and then scoot the feet over to the right, and your pelvis can follow them. Notice that my left leg is pointed in, and what I'm going to do is let it stretch off the table while I keep it pointed inward. So it stretches down like this. Okay? If you happen to do it straight, it goes way too far. It doesn't really isolate the hip joint and the pelvis. You want to hold it inward about 20 degrees and stretch that for 2 minutes. This is another real good one to do once a week. Okay? Now, in looking at books on back exercises, you'll often see teaching backward bending, okay? But I have a modification to that that isolates the lower lumbar joints a little bit better, and that is to walk backwards against the back of your sofa or the back of your bed, the side of your bed. And what you do is you try to lean straight backwards, so you don't arch your back. You actually try to move your upper body as though it's sliding straight backwards. There's not a lot of movement there. It's a little tricky, but I like to do that for at least 10 seconds and keep that posterior glide force, and then do very gentle backward bends. And there's not a lot of range. You want to go very, very gently, and you'll find that this is distinctly different from doing it in this manner. There's less movement when you do it against the bed, but it's much more isolated. So let me take a look at my list and see if I have something else. And that's it. Those are the that's the short list of exercises that I recommend. Thank you very much.